Hi, my name is Brian Wood, and today I'm presenting Primary Care Capacity Planning in Northwestern Ontario, Opportunities, Challenges, and a Way Forward. I'm an associate scientist at Thunder Bay Regional Health Research Institute and Nawsum University, and as you'll see on this slide, my co-authors are affiliated at a host of different institutions in Northwestern Ontario, although all of us contributed to this project on behalf of our roles with the Regional Specialized Services Network, which is where this project received funding. So primary healthcare is the foundation of high-performing health systems and is the first and sometimes only point of contact with the health system for most people. Right now, primary healthcare is expensive and not sustainable, and so we need to reform it if we're trying to improve population health, patient experiences, and ultimately the sustainability of our healthcare system. In northern rural isolated settings like Northern Ontario, these challenges are exacerbated. People can't access care at the right time, the right place, with the right provider close to home. And providers have been working in workforce shortages and under-resourced settings for decades. And unfortunately, the data that we could use to improve our primary healthcare system actually makes invisible the realities of primary care in northern and rural settings, which complicates how well we can tailor healthcare models for these specific contexts, as well as our ability to evaluate them. So to be able to create a northern specific strategy for primary care capacity, we underwent this project. So 4 Ontario health teams in Northwestern Ontario came together, partnered with Ontario Health North and the Regional Specialized Services Network to lead a collective primary care capacity assessment. And the goal of this project, as I'm describing today, was to develop and implement a data-driven, contextualized primary care capacity assessment. And so in 2024, we first began this work and identified the module-based approach to primary care workforce planning, which is highlighted in the middle top of this slide. And the ultimate goal is we want to synthesize needs data, population needs data, as well as primary care workforce supply information, and ultimately assess alignment. Is there a gap between needs and supply? From there, the idea is that we generate scenarios of what are the different ways that we can start to fill those gaps and then begin looking into the future. Ontario Health North developed data packages based on administrative and reporting data to help us understand these modules in 2024. Then the $1.8 billion announcement into primary care came in early 2025, which really ignited the fire for the Northwestern Ontario health teams. And we began to collect our own data to start to fill these gaps. And so we collected workforce supply data, both from primary care providers as well as practice managers at a more granular level than Ontario health teams, to begin to actually understand what are the experiences in Ontario health teams in Northwestern Ontario. Then move into April 2025, we administered and analyzed the survey all in the course of a month. And just as we were wrapping that up came the announcement for interprofessional primary care teams and the urgency for the data. And just to highlight how off some of the data is, in the top right corner of this poster, we highlight the provincially determined high priority populations for primary care in the Northwest compared to all of the populations by Ontario Health Team. And so as you'll see, the map on the left really demonstrates that we're not getting a comprehensive look at what are the needs of populations in Northern Ontario. And so where we're at today is, how do we synthesize all of the different information that is coming to us about primary health care and turn it into an informative and helpful plan for primary care capacity planning specific to Ontario health teams in Northwestern Ontario, as well as this regional body, the Regional Specialized Services Network. And so in the table in the middle of this poster, we describe how we're moving forward with a gap analysis for Ontario health teams. We're still continuing with the module-based approach, comparing needs to supply, aligning with the quadruple aim, and bringing together different data dimensions to actually understand this gap. And we're using a variety of different data sources, our locally administered and analyzed survey, as well as administrative data, survey data, regional and provincial data packages to be able to make the best informed decision in primary care capacity. Going forward, what are we hoping to do? We really need to understand how helpful can a regional primary care capacity assessment be, and where are the opportunities to act. So we know that the expertise for data and primary care evaluation is located regionally. We know that this is a collective priority, so we can achieve economies of scale if the 4 Ontario health teams work together. We know that primary care is the basis of an integrated health system, and so to deliver integrated care in Northwestern Ontario, we need to work regionally. And of course, all of the work that we're doing is to strengthen, not replace, the locally driven work that Ontario health teams and primary care practices are doing themselves. And hopefully we can identify some opportunities and continue to improve data collection, access, and analysis specific to Northwestern Ontario contexts. And this will allow us to explore how primary care capacity gaps actually affect population health and access to care in our region. Thank you for listening.